This video reviews TB terms. You may see some of these terms online, in pamphlets, or hear them from your doctor or other healthcare professionals. You would definitely see some of these terms on this blog. TB disease is an illness in which TB bacteria are multiplying and attacking a part of the body, usually the lungs. The symptoms of TB disease include weakness, weight loss, fever, no appetite, chills, and sweating at night. Other symptoms of TB disease depend on where in the body the bacteria are growing. If TB disease is in the lungs, which is called pulmonary TB, the symptoms may include a bad cough, pain in the chest, or coughing up blood. A person with TB disease may be infectious and spread TB bacteria to others. BCG is a vaccine for TB named after the French scientist who developed it. BCG is rarely used in the United States, but is often given to infants and small children in other countries where TB is common. A chest X-ray is a picture of the inside of your chest. A chest X-ray is made by exposing a film to X-rays that pass through the chest. A doctor can look at this film to see whether TB bacteria have damaged the lungs. A chest X-ray is not painful, so don't be worried. Contact means a person has spent time with the person who is infected with TB. A culture is a test to see whether there are TB bacteria in your phlegm, which is another word for the word sputum, and it's the material that sometimes you cough up like a mucus-like material, or other body fluids. This test can take 2 to 4 weeks in most laboratories. Directly observed therapy, or DOT, is a way of helping patients take their medicine for TB. If you get DOT, you will meet with a healthcare worker every day or several times a week. You will meet at a place you both agree on. This can be the TB clinic, your home or work, or any other convenient location. You will take your medicine while the healthcare worker watches. Pulmonary TB is TB disease that occurs in the lungs, usually producing a cough that lasts 3 weeks or longer. Most TB disease is pulmonary. Extrapulmonary TB is TB disease in any part of the body other than the lungs. For example, the kidney, spine, brain, or lymph nodes. HIV infection, the infection called human immunodeficiency virus, is the virus that causes AIDS or acquired immunodeficiency syndrome. A person with both latent TB infection and HIV infection is at very high risk for developing TB disease. Latent TB infection, a condition in which TB bacteria are alive but inactive in the body. People with latent TB infection have no symptoms, don't feel sick, can't spread TB to others, and usually have positive TB skin test or positive TB blood test reaction. But they may develop TB disease if they do not receive treatment for latent TB infection. Sometimes when you hear the word latent TB infection, you'll hear the word dormant instead of inactive, and this just means that the TB bacteria isn't alive and multiplying and growing in the body. Mycobacterium tuberculosis is the bacteria that causes latent TB infection and TB disease. TB blood test is a test that uses a blood sample to find out if you are infected with TB bacteria. The test measures the response to TB proteins when they are mixed with small amounts of blood. TB skin test is a test that is often used to find out if you are infected with TB bacteria. A liquid called tuberculin is injected under the skin on the lower part of your arm. If you have a positive reaction to this test, you probably have TB infection. Other tests will be needed to find out if you have latent TB infection or TB disease. Negative usually refers to a test result. If you have a negative TB skin test reaction or negative TB blood test reaction, you probably do not have TB infection. Positive usually refers to a test result. If you have a positive TB skin test reaction or positive TB blood test reaction, you probably have TB infection. Resistant bacteria are bacteria that can no longer be killed by a certain medicine. So this means, in the case of TB, that the TB medication prescribed does not work. It isn't strong or powerful enough to kill this bacteria, to stop it from multiplying, or to get rid of it. Sputum is phlegm coughed up from deep inside the lungs. Sputum is examined for TB bacteria using a smear. Part of the sputum can also be used to do a culture.